Welcome. Good morning. And I'm glad we have a microphone so you can hear me and I don't have to stretch my voice too much. We're going to start in here this morning, so make yourself a little comfortable. And I assure you we're going to be up and about in this room and that room and that room a bit. So make sure that you've got your running shoes on. We're going to keep you moving as we go forward. My name is Daniel Stein. I'm the managing partner, one of the co-founders of Stewards of Change. And I want to welcome you here to this magnificent facility. And to the beautiful weather that we've all brought here to New Haven. We are assembled here for the 6th Annual Stewards of Change Conference. And I want to thank you for taking time out of your incredibly busy schedules to schlep up to New Haven, Connecticut. I want to also mention this building a little bit. It's a new facility here, and we had the good fortune to be able to start to use this facility last year. We kind of outgrew our other room, which was called, fittingly, the General Motors room. So the birth, the death, and sort of the phoenix rising of that room. It was a much smaller room. It's kind of wood paneled, very sort of academic looking. But I assure you that there was not the level of comfort here. There was one bathroom within vicinity. So we do have a few more of those. I'm sure you found them over there. This is, I think, a gold LEED building, so it's incredibly well designed. And we were trying to get a tour of folks here, but we're in the middle of the break, so a lot of people who would be around normally are elsewhere, as academics are known to do during breaks. So you'll also notice that New Haven is a little quieter than you might notice. Where all the students, well, they're gone somewhere else. So what we're going to do here is I'm just going to do a little bit of introduction, welcoming here, and then we're going to do some group introductions, and then we're going to move into that room over there. But I wanted to, as I said, again, thank you for coming. The audience here, there's about, I would guesstimate about a third of you have been to one or more conferences in the past, from my numbers here. But there's been a lot of participation from states and counties, the same states and counties, just different people coming over time. So there's been a bit of continuity over the years. Let me see hands of people who have actually never been to an SOC conference before. So it's a lot of folks here. So I lied. I don't know where the third are. Maybe they're on the way this morning or something like that. Or you've forgotten or something like that. I'm not quite sure what the story is. My numbers don't lie, right? Where are those numbers? Who got those numbers for me anyways? As I said, we have about 14 states and assorted counties represented here, and a lot of the regions from across the country. So Southeast, Mid-Atlantic, New England, Midwest, West Coast, and then the Northwest are in attendance here. And which is nice because we also have large jurisdictions and also some smaller ones. So whether or not it's representative of the country, I can't say, but it certainly does provide a good representation of opinion, probably, and experience from across the country here. And I think that will benefit us as we're having conversations over the couple of days to really think about and understand the diversity that's going on across the country. I want to also pay recognition and thanks to our many supporters and sponsors who have helped make this happen. We have 2 champion sponsors this year, and those are Microsoft and IBM. And I want to thank you and your organizations for the continuing support for this work around interoperability and helping provide some of the resources that it takes to build these kinds of conferences, as you all well know. We have also a number of other supporter organizations. Curm Software was generous to be a supporter, as well as 2 foundations, the William Penn Foundation and then also the Annie E. Casey Foundation, who I don't think Kathleen is here yet. I think she's on the way. But Annie E. in particular has been particularly helpful, especially in the early years of our conference, where, and I'll talk about that a little bit, who have been really strong supporters of this work going forward. There are also a number of other people who have been very supportive of the work here, in particular Administration for Children and Families. And I want to acknowledge and thank you for the work and the dedication and the trust you put in us in helping sort of move this vision forward. We have representation and support from our federal partners, from CMS and ACF, and also Food and Nutrition, which is terrific to be able to have the federal leadership here, as well as other senior leaders within ACF who represent both the Children's Bureau and the Office of Child Support Enforcement, who we'll hear from tomorrow, which is terrific to have that sort of mix here. Also, a number of you have contributed articles to this year's primer. I think about 15 of you, so I really appreciate the work and the effort that's gone into that and helping share your experience and your knowledge and your orientation and perspective on how you view some of the particular challenges that we're looking at right now. And you'll see those names in the primer, and many of those folks are here. It's amazing to me, even in a group of 100 people, the number of stories that happen, things that happen to people. So I mention that because it seems like a relatively small number of people when you're trying to bring them together for a couple of days. But what's always surprising to me, I'm not sure why it's continued to be surprising, but everybody has a life. Everybody has stuff going on in their world, right? And it's amazing to me that most people actually end up being here despite the personal stuff, business stuff, orientations, those kinds of things. And when I extrapolate that out to 300 million people in this country, and think about everyone's got a story, and everyone's got a life, and everybody's struggling with their worlds, it's not surprising to me why this work is so important and so critical. As we have the privilege of actually coming together to do this work, there are millions and millions and millions of people who are just trying to make their lives happen, and every day they're struggling with many, many, many challenges. And I think that is, in some ways, a real setup for where we're here. I want to just spend a couple of minutes talking about kind of how we got here, because as I said, there's a lot of new people here, and I think what's important about these conferences that it provides a forum for people to begin to share ideas that would not necessarily come together in this particular sort of cross-disciplinary, multi-sector kind of approach, which we think is kind of unique. This journey started not with that in mind. It started 13 years ago or so, after I had worked at Kraft Foods for about a decade, working on products many of you probably have on your shelves right now in your homes, or actually probably less product than you used to have of Kraft Foods, but nonetheless a ubiquitous brand. I left there and I began working in child welfare quite serendipitously when I met Vernon, who runs also a large child welfare organization in California. And what he was trying to do was trying to bring sort of more standardization and rationality to an organization that was spread across the state of California, and was looking for actually the application of business practices. How do you take what's in the business world in some fashion and adapt it to an organization that was trying to support families and children in the community? And we began working together, and what we discovered was, in fact, there was a lot of overlap, and there was a lot of application of stuff that was very standard in the business world that we take for granted. We began, as I said, we began to work together, and we saw the application of those things. Probably the most poignant observation was this idea of supply chain. You probably all know about supply chain, but it's kind of the process from sort of the grower, from the farmers to the point in time when you actually go to the grocery store or actually purchase and use the product. And that system of process reengineering has really been refined over the generations within the packaged goods industry. And every step of the way is carefully understood and measured and quantified and measured and analyzed so that you can improve each of the steps along the way. And we saw a great application of that in this field because there are so many places where the process goes from individual to individual to group to group to group. And so we began to think about that, and as I said, I was surprised by the lack of those kinds of thoughts and those kinds of approaches in this field, given it was sort of standard operating procedure in business. Why there was a lack of this? This was about 10 years ago. Why there was such a lack of standardization and process that was going into this field. We had, when I was at Maxwell House, a tremendous knowledge base around what our consumers were thinking, feeling, wanting, how they lived in the world, and how we would try to communicate with them. We had a $30 million budget for one business to understand their behaviors and their attitudes and awareness. And as I looked at that and contrasted it with the requirements of health and human services, and really didn't see that same kind of investment, it struck me as, I was trying to find the right word, either absurd or ludicrous or just outright criminal, that those kinds of resources I'm thinking would go into optimizing the design, production of near and dear to my heart, bagels or donuts, and yet we didn't really know all of those same details for children and families. I have this stark recollection, memory of being in an R&D lab, and there was a team of PhD engineers and a PhD food scientists, and they were assiduously talking over how they were going to get the sesame seeds to stick to the bagels so they could ship them across the country so they wouldn't fall off. And I had this image of this group of white lab coat guys standing around saying, how are we going to get these sesame seeds sticking to this bagel? And the debate was vociferous, how that was going to happen. And I'm sitting talking to Vernon saying, how do we apply this? What's maybe we don't have to put barcodes on the kids, but maybe there's a way we could apply some of this knowledge and learning. And so off we started on this journey of really looking at if there was an application for, at that point in time, recruiting families for children in foster care. Ended up spending a bunch of time working in New York City, looking at those same kinds of questions and really addressing the question of scale at that point. New York City, for those of you who don't know, is basically a privatized child welfare system with, at that point, about 37 private agencies delivering care to, when we entered, about 30,000 children in care. Huge, huge kinds of questions, and really trying to take what we had learned in California and apply it to at scale in New York City, and had a modicum of success. But probably what was most important was the questions that we started asking, which was, why? We all know that why. So we asked it more than 5 times. And we didn't get an answer. I was expecting fully to find folks really engaged in this conversation around how do we take business practice and apply it to these very granular kinds of problems. And we didn't get it. We got a lot of shrugs and a lot of sort of blank stares saying it's a great idea, but we got work to do. So we kept asking questions, and finally ran into some folks at the Casey Foundation, in particular Kathleen, who said that's a really sort of vexing kind of problem. We want to address it. Our foundation is interested in that. What are you going to do about it? Right? Okay, great question. Easy to ask a question, but what are you going to do about it? So we said, let's have a conference. I don't know what to do, but I know there's a lot of smart people out there who are interested in the conversation. Let's see if we can get them together and start talking about it. So that happened 5 years ago. And the title of that conference was Entrepreneurial Solutions to Child Welfare Challenges. And we brought about 70 people together, much like this group from across the country, and sort of put the challenge on the table around what and how. Was there a role for entrepreneurship? Was there a role for innovation and the application of business process and technology? And sure enough, there was a loud and positive response to that, saying, yes, we need to figure that out. We need a mechanism and a place to be able to think that way. We're all so busy. We don't have time to think strategically in our jobs. We're so focused on getting the work out the door. And so that really launched us in this direction. And at the time, at the end of the conference, we did a sort of a prioritization of what was most important to folks. And what we heard were a number of things. How we're going to deal with this workforce, right? It's leaving and changing. How we're going to deal with that. How we deal with communications and marketing and all those kinds of things in terms of getting our message out across the country. And this question around technology and how information technology at that point in time, the promise of it hadn't delivered on what people were hoping for. And that there was a recognition of a lot of expenditure in technology, in some areas in particular, and that there was a frustration that it wasn't delivering on what people had hoped for. So the Casey had asked us to spend a little time looking at that and doing some environmental scans. And we did that. We spent about 1.5 years, 2 years actually looking at, across the country, things like ZACWIS and other kinds of systems out there and what was going on in the technology field in terms of where it was at, where it was progressing, what the trends and technologies were, and why wasn't it delivering on the promises that were out there in folks' minds. And so over the last since that first conference, we spent about 3 years really looking at information technology, what were the innovations, what was happening out there, and ran into some partners, some folks. Bill O'Leary in particular from Microsoft was a great partner. He had just published a paper on how Microsoft was thinking about, in particular, the application of technology in the public sector. And so we had some very interesting conversations around how do you think about technology, and then brought in a number of other folks who were also thinking about that and started this sort of affiliate partnership around bringing people together to really think about these issues. A lot of innovation, a lot of emerging technologies, and then voila, we bumped into this idea of interoperability. Boy, you really could connect systems. Bill's looking at me saying, yeah, you can connect systems. So we discovered service-oriented architecture and XML and shared services and all those kinds of things that you may be familiar with, hopefully. If not, by the end of this conference, you'll know more about that. And so the question was, yeah, great, you can connect it. Okay, what do we do when we connect it, right? At Kraft, we had lots of MBAs, lots of analysts, lots of folks, lots of data, lots of good, fresh, clean, sort of right as soon as you buy stuff, you get the data, right? It's available. And still we had huge problems making sense out of it, making data-driven decisions, right? Using evidence, which we had, to really make business decisions, which are very much simpler than what we have here, spend more, spend less, distribute here, distribute there. So the fact that we were going to now get all this more information through this promise of interoperability really was concerning, because people are challenged. The field of social work, people don't go in it to become quant jocks, so typically we need to provide information in a way that people can digest and use readily, and a lot of the systems were not really designed for that. And so what was going to happen with the convergence of this rush of information with a workforce that was not really necessarily open or know how to use this information? And that really birthed the idea of Human Services 2.0. And the last couple of conferences were really focused on what happens when we can connect systems and what happens when we can provide more information to folks. And what that really did for us is it raised another set of questions, which were how do we think about those problems in some kind of methodological way, or some kind of process that would allow us to really not have to recreate the wheel year after year, right? So as we were looking across the country, we saw a lot of people beginning to really struggle with these questions, and some of them were actually having some success. And so we spent some time in places like Nassau County, who was one of the originators of No Wrong Door, Mecklenburg County, Montgomery counties, both in Maryland and Pennsylvania, Allegheny County, a number of counties, a number of states who were actually struggling with trying to address this issue. And what we did is we sort of uncovered, almost from an archaeological perspective, an anthropological perspective, we uncovered what seemed to be some similar practices and approaches, how they were thinking about integration. And over the last couple of years of the conferences, we began to distill those out through conversation, through presentations and discussion. And a lot of those things, and when you have time in the other room, please, we're going to pay attention to some of those maps, because the landscapes and the maps and the approach that we took began to really articulate those and make them visual for us. And what we discovered were, in fact, there were a set of drivers or domains that were very common to systems that were doing this kind of work. And we named them, and then we made some pictures around them and started to really describe to people the process that we saw and that we began to articulate with the attention and the help of literally hundreds of people who've been to the conferences over the last couple of years, to really think about these drivers and to think about how they would help us in terms of creating a process. And so what we've been busy doing the last couple of years is to take that learning and that knowledge, synthesizing that, and putting it into sort of a language that we could use and that you could use. Because again, one of the things that we were really what we saw was this lack of a language, right? We don't have a common language when we talk about interoperability. Or, in fact, we do, but we don't know what to call it. And so what we've done is we put some labels on it, and we've started to build out some of the thinking behind those ideas so that we could share it. So when people are working both within an organization and across an organization, we can have a common language. So what do you think about the workforce issue? What do you think about crossing silos? What do you think about things like confidentiality and information sharing and security? And that has proven to be very powerful for folks to be able to actually orient themselves with a process and a language and a methodology to do some type of assessment of where they're starting from. Along the way, we also had the great fortune to run into CMS and our friends Rick Friedman and folks who have been thinking a lot about similar kinds of issues related to MITA, Medicaid Information Technology Architecture. How do you create some standardized approaches for helping states and people think about the challenges associated with these? And so we borrowed heavily from that kind of approach and thinking and built it into this model and approach so that we could both help people think about where they are starting from, what the baseline is, because if we don't have a baseline, we can't measure the changes that we're going to be implementing after we actually implement the changes and the technologies, and the assessment tools, and the language, and the visual maps. And so with that combination of thinking is what we're calling Human Services 2.0, and it's offered up to the universe in many ways to be able to help people and systems really work that through as they're on this path. One of the things, just briefly, in terms of the way this is used is as we think about the drivers, and I want to offer them up to you, they're in the primer that you have as well, is a lens through which to view the work over the next 2.5 days. Because it's overwhelming to think about interoperability. There are too many things to think about and to keep in your mind at one point. But we can almost think about these as touchstones. So as you hear and as you think about the conversations you're having, it might provide a lens to say, how are we framing that discussion? What is this referring to? Is this referring to a workforce issue? Is it referring to a technology issue? Is it referring to a silo issue? Is it referring to open and inclusive processes? The public-private partnership kinds of things. So it's a way of beginning to categorize and think about this work and to be able to focus and drill into it. Interestingly, one of the things that we focused on earlier in this year was the issue of confidentiality. What became really clear is that that may, in fact, be the Achilles heel of interoperability. Many of the folks we've worked with have said, yes, but. Yes, but how do we address HIPAA and FERPA and 42 CFR? Of those of you out there, let me see a show of hands who have said, geez, this confidentiality issue is a challenge for us as we're thinking about interoperability, right? It is probably one of the most fundamental things. And so what we did is, in some of the work we were doing in Pennsylvania, this issue came up, and our work with University of Pennsylvania School of Social Policy really dove into this issue in particular and thought about it. And then earlier in the fall, we held a conference with, similar to this, about 65 people from across the country to really dive into the issue and sort of the myths and realities of confidentiality. And of course, one of the things that you know is that there's not a lot of clarity, right? People are really confused about what they can do, what they can't do, and most people don't like the idea of pinstripes. So people are actually very scared of what the legal implications are of sharing information. So they get very conservative, generally, in their approach. And so what we've done is we've started to look at that particular issue through this driver of confidentiality. There's an article in the Primer as well that reviews the conference briefly, and that there's also a white paper that'll be coming out from UPenn, Dr. Gellis, and Deb Wolf there later in the year that will hopefully spread a little bit more understanding and clarity around that. So also, interestingly, as we were doing some work with ACF recently, we brought this issue up, and I know that it's become sort of front and center from a federal level where programs are more sort of grantee-focused and intermediary-focused. It didn't resonate as much because they're not dealing with the on-the-ground sort of issues of transfer of information, getting aggregate data or getting data that you can use. And so I think the issues now, it's percolating up to the point where we're starting to connect the various levels down so that we can have the dialogue. And some of them are structural kinds of changes and policy changes. Some of them are just clarification of process and practice that we need to sort of understand better as we move forward. A critical issue, and we'll talk more about that as we go through the next couple of days as well. So, why are we here, right, is the question. What's the purpose of this conference? We've written a lot about it, and materials kind of articulate that. But I think the thing that's really striking is that while we've said this in the past, I think it's really come to a head. I think this is what people refer to as an inflection point or a paradigm shift. We are at that verge now where we actually are staring at the opportunity to make the changes many of you and many of us have been talking about for a bunch of years. And that's a result clearly of the dire financial consequences. People have to make the changes. We sort of started talking about that a couple of years ago at the beginning of the financial crisis. But I think it's clearly upon us now, and I'm sure that all of you are acutely aware of those issues at the state and the federal level and the local level. So that demand for efficiency and that demand for getting smarter about the dollars we do have and how do we use those, and getting smarter about how do we use the information, the systems, and the investments we have now to drive better outcomes for people. Because ultimately, the process is all about, are we helping people develop self-sufficiency in health and education and all those kinds of things more effectively. And so that sort of coupled with the turnover in states, and a lot of new people coming into positions, looking for how to move forward with that, and then the urgency of healthcare. Right? The Affordable Care Act is upon every state, right? In some way, shape, or form, they're having to deal with that now, and so there's a tremendous need and interest to make that happen. And what we've been really focused on a lot is how do we make sure human services is not left out of that equation? And because of the drive, because of the pressure, because of the time requirements, there's a huge drive to make that happen quickly. And so we feel, and I'm talking largely here, that there's a need to make sure that human services writ large is actually at the table and participating in that conversation. Because if we don't do that now, we may be left behind. We may be left in a position where architectures and designs and systems are put into place that may or may not have the flexibility and the ability to integrate human services or education or juvenile or courts in to making the kinds of decisions we need. And that will be a generational decision that will have been made, and we'll have lost that opportunity. So we're looking here now at an opportunity to think about that clearly and carefully together, and to drive that conversation in very pragmatic and practical ways. What do we do here over the next couple of days that can help drive that conversation at the local level, at the county level, the state level, and begin to create more of a community of practice to make sure that we're disseminating that knowledge, that information, people understand what we're doing, and that there is now the moment in time to make that actually happen. And of course, the benefits of that would be better outcomes, more efficiency, more effectiveness. But this is not a theoretical exercise now. The opportunity is real. It's in front of us. And one of the most impressive and sort of timely things is this little memo that we put into each of your packets, which is the dated February 28th from the White House. And so I want to thank the President for issuing this right before our conference. Told me he was going to try to get it out, but in fact he did. Sometimes timing works for you, and I think this is, for those of you who haven't seen it, has everybody read this yet? Anybody not read it? Okay. Well, if you haven't read it, please read it in the next 5 minutes or so. So I won't necessarily quote from here, but some of the language in here is exactly the words that have come out of your mouths many times, and we've written about, and many of us have thought about this. Actually, I can't help myself. I really have to read one paragraph here. There's so many good things to read here. I'm instructing agencies to work closely with state, local, and tribal governments to identify administrative, regulatory, and legislative barriers and federally funded programs that currently prevent states, localities, and tribes from efficiently using tax dollars to achieve the best results for the constituencies. I don't think we could have written any better, right? So there's a lot of great stuff in here that really is a call to action, and a call to action in the short term to make this happen. And I kind of view this as an opportunity for us here today to sort of put some of those ideas on the table. What is it going to take? What kind of flexibility do we need? What kinds of authorization? What kind of permissions do we need? What kind of specific ideas do we need to move this forward? And so the urgency of that and the timeliness of that is really, really critical here. So as I was preparing these remarks, I was saying, well, what do we know? How do we know if we've been successful at this conference, right? How do we know if we've actually spent our time wisely here? And so a couple of things I've talked about here is have we learned something new, right? We all try to learn something new when we go to a place. So have we learned something new here, and particularly about interoperability? And have our discussions and our sessions identified the implications, the opportunity and challenges related to interoperability and the impact on human services? So if we clearly articulated those things both in writing and in images and communicated that with ourselves? Have we identified specific strategies and maybe even some action steps that would be useful for moving this conversation forward? Now, what's different and challenging here is everybody's from a different jurisdiction. We all have different bosses. We all have different organizations we're going back to. So it's a diverse group, and so we're trying to find strategies and ideas that are actually ubiquitous in a way, that apply wherever we end up going. Have we contributed to the directive represented by this executive order? Have we actually gotten some language and some ideas that could be helpful to the both the federal and state organizations that are here and will be asked for probably some input into this? And have we been successful at invigorating you and inspiring you and having you help meet other people that you might not have had the opportunity before, to begin to create a community of practice that can go on beyond this conference? And I think that's one of the things that has been really interesting and exciting for people who've been here, is that we're beginning to connect people across the country in a unique way, and that network is probably the most powerful thing that can come out of this, so that San Diego can connect with Maryland because they're on the same path, but they didn't know each other, were doing the same work before. And I think that is a huge opportunity. And so we've allocated a lot of time. It was very difficult from our design team's perspective not to fill every moment of the agenda with great presentations, because there's a million great stories here. And so we worked really hard to leave a lot and to engineer and design time into the agenda, 5.5 hours, aside from the breaks, lunch, and bar time, which is not to be where most of the work gets done there, I know. We've often joked we just probably don't even need the presentations, just kind of leave you at it for a while, throw a couple of questions on the table and a couple of drinks, and we'd be very successful moving forward. Sort of in closing here, I think of this as a soup, maybe a bouillabaisse. And the ingredients are all in the room, right? And it's what we're going to put into that soup, how we're going to spice it, how we're going to mix it, how we're going to contribute it. And we've got a 2.5-day cooking period here that will allow us to come up with something that has not been created in the past, right? We don't really know what's going to happen here. But through your participation, and through your engagement, and your attentiveness and participation, we're going to come up with something that I feel pretty strongly is going to be valuable, is going to be exciting, is going to be worthwhile, and hopefully you'll be able to take back with you in a meaningful way and spread within your organizations, whatever those happen to be.